All right. Hello, everyone. My name is Julius Austin. I am with the Sacramento Promise Zone. I'm the Sacramento Promise Zone coordinator, and the lead agency for the Sacramento Promise Zone is the Sacramento Housing and Redevelopment Agency. And I want to welcome you to this really important information session that is titled the Samuel Merritt University Nurse Volunteers Info Session. I really have a great opportunity to hear from Dr. Alice Vestergaard. She will share the processes necessary to take advantage of some really amazing nurses so that they may provide health education, health services, and some other opportunities for you, your organizations, and the people you serve. Just really, really excited about it. Before we get deep into things, I really want to thank you for being here and taking the time. We know that there is so much going on today with our inauguration. And also, we know that folks are dealing with so much these days with the pandemic and so many other things. And so I really feel honored that you would take time, despite all of those things, to join us. Just some quick housekeeping things. The presentation is being recorded, so I want to notify everyone of that. We are recording it so that we can share the information out to you all and also to other partners who may not have been able to attend so that everyone can take advantage of this great information that we're going to hear today from Dr. Alice Vestergaard. I see right now, I may not even need to make this statement, but please continue to be on mute throughout the presentation. Throughout the presentation, there will be an opportunity to pose questions or make statements, and I will be kind of monitoring the chat box so that I can refer those things to Alice throughout the presentation. Also, there will be a question and answer session after Alice's presentation, and you can still continue to pose your questions in the chat box. And then, other than that, we are going to get rolling with a really awesome agenda. If you haven't already, please place the name of your organization in the chat. And also, don't want you to ignore Alice at all, but if you get an opportunity to complete the poll that's in the chat box as well, that would be really helpful. So it'll be a really easy agenda. We'll have Dr. Alice Vestergaard come on and do her presentation. And then afterwards, there'll be a Q&A session, and then I'll come back on to just do a little closeout to share a little more information with you all. So I'm excited. Today, I usually, most folks who know me, I know a lot of you usually don't see me without a suit and tie on, but you can see I'm at home. And I was gonna also put on a suit and tie today just because during the pandemic, you don't do it as much. But I decided what might be more appropriate was to wear my Learn t-shirt today. I don't know if you all can see it, because this is a great opportunity for us to learn from Dr. Alice Vestergaard how we can take advantage of these nurse volunteers. But I think what's more important is that we all can work and partner together, which is the goal of the Promise Zone, to increase health opportunities and health access, health information for the people that we serve. And so with that being said, I'd like to turn it over to Dr. Alice Vestergaard.
All right. Thank you, Julius. Welcome, everybody. It is great to see you. Thank you for taking time out of your day. Some of you I've worked with before, and it's great to reconnect with you, even though it's in the screen environment, but it's wonderful to see you. There's some on with us today that I know your names. I've seen your names in various community settings, and it's wonderful to connect the face with the name as we all acclimate and get used to this screen environment. Regardless of whether I know you or not, I just really want to acknowledge your presence here and during this time. Not, you know, as Julius mentioned, there's so much going on. So for you to take time out of your day is very meaningful, and I hope will be worthwhile for you. As Julia said, my name is Dr. Alice Vestergaard. I'm not a medical doctor like some of you on the call. I'm a doctor of education, actually health education to be specific. And my title is Regional Coordinator for the RN to BSN program, although I also serve as the community liaison for Samuel Merritt University. So I'm going to share my screen now, and for those of you who have worked with me or liaison with our university, we have some regulatory changes, so where we can place students and how we place students. So you will learn as well as we go through the presentation. And for those of you who don't know anything about Samuel Merritt University, hopefully this time will be insightful and give you some background in how we may partner, because we have some projects that are ongoing and also new start projects. So I'm going to share my screen now with you and start my PowerPoint. And we'll just proceed there. And hopefully in just a second, you'll be able to see my PowerPoint. There you go. So again, my name, my official title, I actually serve the whole Central Valley because we do have a campus in Fresno. I know there's someone on the call with us today who is in Fresno, although we're going to focus on the Promise Zone geography today, but we serve the entire Northern California area, with my part being overseeing the Central Valley. So yes, I am a Valley girl. And in fact, I started my own career in the Promise Zone many years ago with something called the Sacramento Area Economic Opportunity Council. Some of you weren't even born when that was around, but so I've been in and around the Sacramento region for a long time and have come full circle in many respects. So just an overview about our university. We have a long legacy. Even though some of you today, this is the first time you're hearing about Samuel Merritt University, or you don't know much about it, it's actually around since 1909, and it's a private, not-for-profit health professions university. So that means we are specializing within the healthcare sector. We actually have our home campus in Oakland, California, in a very urban setting, and we have undergraduate and advanced degrees in occupational therapy, physical therapy, physician's assistant, and nursing, which includes a nurse practitioner and certified nurse anesthetist. So then we have our branch campuses in Fresno, San Mateo, and our learning center here in Sacramento. Sorry, I have allergies today. I don't know if some of you are also suffering. We have our unusually warm weather has brought about tree pollens that aren't normally out this time of year. So I have my water here, so excuse me if I have to catch my throat or whatever. The university has a very long diversity, equity, and inclusion history, and it is part of our mission statement, and our values. So right now, classes, for the most part, unless they're clinical, are online. Except for the clinical components, because we are health professions, so we're training nurses who have to have hands-on experience. And then as part of that training, they also do community hours through as I'll talk in just a minute, their requirement for community health nursing in particular. And then the other programs that are in Oakland also have community requirements. And then we have hybrid formats. So for example, right now in RN to BSN, these are people that have registered nursing licenses already. So they're Their lecture is all online, as so many of you are doing online delivery as well in your settings. So I mentioned our mission and our long legacy of diversity. And so as you read this on your own, you can see right in our mission statement, we transform the experience of care in diverse communities. And then our philosophy of teaching and learning itself. One thing that is notable about the university, it has an alternative admissions policy. So we don't just look at, for those who are applying into the program, we don't just look at grades. We look at the whole person, and test scores and things that are in traditional academic environments. We have a more global admissions policy. And this means that coming into our university as students are sort of what we term non-traditional students. If you walk into one of our classrooms, for example, it looks like the United Nations. We have multiple cultures, multiple languages represented. And this will be of value to some of you who are interested in having programs delivered in specific languages. We can accommodate that most of the time. So I wanted to talk about the classification of the nursing students, because that can get confusing as you're thinking about how you might want to utilize the services of our students. We have pre-licensure students. So these are students who have bachelor's degrees in other fields, but they haven't passed their certification exam. So they're not registered nurses yet, but they have bachelor's degrees. So we call those pre-licensure because they haven't taken their license yet. And then we have students in the program that I'm connected to for predominantly most of my time, and those are RN to BSN students. So they have their RN license. They're actually working nurses, and they are out, you know, in hospital and healthcare settings in the community, and they're coming back to get their bachelor's degrees. So in some cases, they have many years of actual hands-on nursing experience. The great majority of them are hospital-based, not community-based. So we call them, in common terminology, bedside nurses. The average age in that program is age 45. So these are very experienced people. Regardless if they're pre-licensure or in the RN to BSN program, part of their requirement when they come to us is that the State of California Board of Registered Nursing stipulates that in order to get a bachelor's degree in nursing, which both these groups are doing, you need to have 90 hours of direct client service in the community to qualify for a public health nurse's certificate. So this is built into both of these programs. The difference in the programs is that the pre-licensure students, the ones that have bachelor's degrees, are considered full-time students while they're with us. And the RN to BSN program students are actually part-time. So they're working their full work schedule. If you can imagine, you know, hospitals run 24/7. So they work all shifts and all geographies. And so then they come and they take their lecture class online right now. And when COVID abates and we're safely able to go back to a physical campus, they will perhaps come back or perhaps remain online. We don't know yet. Then at our main campus in Oakland, we have all these other programs: physician's assistant, occupational therapist, and the other programs, physical therapy that I showed you. Those students if they want to do volunteer work, even though they're based in Oakland, we have the capacity for them to do some online training for your clients. So I'm going to talk a little bit about that in a minute. So these volunteer nurses and nursing students and other professionals are available both as independent volunteers, so not part of the class, not for a grade, not for a requirement. And that means no contract is required. And they can do staffing events for you. They can do demos. They can provide resources, conduct workshops, both on ground and online. All of our students, regardless of program, have had complete criminal background checks, fingerprinting in their organizations of employment, and all of their vaccinations and shots. So we vet that, although some of our organizations that we partner with do require their own fingerprinting, such as school districts. And so whatever the need of the community organization is, we accommodate that. But we do our own in-house screening as well. And of course, every student has to pass a drug screening. If you have a need for a volunteer, so this is a volunteer who's not coming to your organization as part of a course, then you would simply contact me as in far enough advance as your specific need is, and then I would put out through our resources an ask to the students who most fit, or to the active, already certified folks who most fit with your needs. You can specify your language needs or any of your DEI needs, because remember, I mentioned that we have a very diverse student population. So if you want a male Spanish-speaking nurse to come in and staff your event, you can ask for that. We try very hard to accommodate that. One of the benefits of COVID, or I would say the positive outcomes, is so much has migrated into online, and therefore it has opened up a tremendous number of opportunities for us, because we can tap into, being around since 1909, a very diverse network of alumni and current students and current faculty. So we have a tremendous capability to serve your needs in online. On ground is a little bit different, because in the volunteer capacity, then they would maybe need to come physically to do a workshop for you, and or physically to your event. So we do require our students, unless they have a medical form on file that disavows them being able to take the COVID vaccine, we do require it for all of our students. I want to go back to talk about, if you want to have one of the requirements for the community service hours, if you want a group of students for that, I think we skipped a slide here, so let me go back. So for the community placement side, the agency signs a contract with, some of you on this call have signed contracts and do have current contracts. Some of you've signed a contract and it expires, but a contract is required before we can work with a community agency, because we are placing students and there's liability. Now, our students need to be supervised when they're on your site, if that's the route you want. And we place groups of students from 4 to 8, supervised by an actual Samuel Merritt University faculty. The regulations have, in the last year have tightened up about that kind of supervision and the kinds of activities we can do with community organizations. It needs to be direct client service hours as opposed to going through a lot of training at your agency. They need to come into your agency, have some type of orientation about your agency, who are the clients, some demographics about the clients, and then the bulk of those 90 hours need to be providing direct client services such as health screenings and health education, or we do have home visits as well. For the pre-licensure students, they come either 1 to 2 days a week for 4 hours, 4 to 8 hours, depending on the semester. This goes year round, and it varies from term to term, which makes it a little tricky. But this is where your client needs have to match their curriculum. So if there's a match, we can likely place. And for the RN to BSN students, they come 1 day a week for 8 hours for 12 weeks. And the availability varies, depends on the semester, because we have admissions, we're on the semester system, which a semester is 15 weeks. But within those 15 weeks, both of these can be accelerated. So that's why you see pre-licensure students come either 2 days or 1 day, but they have to have approximately as close to 8 hours of direct client service. So that may mean they're physically there, but they're not serving the students because they're planning and they're researching and putting together curriculum. But we vet each community site to make sure that you're going to meet the requirements of the State of California Board of Registered Nursing in terms of what our students are going to be doing with your clients. We have sent them out, depending on the agency, on home visits. They are supervised by a faculty member who sees their work and meets with them at your site, actually comes physically there and supervises them and communicates with you to make sure that the students are of service to your organization and fulfilling your needs. So if you are interested in talking with me or contacting me about having either volunteers you're going to do a special event, or you have a special need for an education program, or you are interested in having our students come on site to do their 90 hours, please email me at this email, Alice A. Vestergaard at samuelmerritt.edu, and there's my phone number, 916-956-7640. And we can talk more because if you want to have the 90 hours program, there is a vetting process. And I have several colleagues who are overseeing community health placements, and they would be following up with you to get some information and also go through the contracting process, which for school districts, your risk management folks usually have to review the contract. It's pretty straightforward, and some of you contract with other nursing schools. We can't step on each other's toes, so that also has to be determined. If you're having students from another nursing program come on Tuesdays and our students can only come on Tuesdays, then that wouldn't work out probably, because we can't interfere with another school. That would be unethical. So there's all these little contract issues that crop up, but basically we have an incredible network of folks who can serve your clients. And in accordance with our mission, we want to make this available to you And it's a matter of just knowing what's out there in our community. And I think that's one of the benefits of the Promise Zone is we collaborate and we share, because those of us on the streets know it takes a village. No one organization can do it. And in this day and age, it's always issue of resource utilization and resource optimization. You may not have the capacity to have someone research and develop special programming on a topic that's of interest to your clients. Or you may not have even thought about, gosh, so many kids are now working at home. They need help setting up ergonomically their workspace to make it healthy for them? Or what kinds of exercise can they do in the home? And do their parents or guardians or care providers need tips on low cost meal planning? There's a whole variety of topics that we can provide because we do have these programs, and we do have a diverse group of folks who can come in and do these programs for you, whether in online or in person. At this point, I'm going to stop sharing my screen, and then we're going to open it up for some questions that you may have. So let's see. If you have a question, we'd like you to post it in the chat.
All right, don't be shy. Any questions that you might have, please place them in the chat, and I'll read them out for Alice to answer. I apologize, my son is a little weird on my face right now. But in the meantime, while people are thinking of questions, I just want to give a shout out to Alice and thank her for doing this presentation, but I also want to thank her for being what I call like a model Promise Zone partner. She gets it. She understands that partnership and collaboration is a great way for us to create greater impact for people who need it. And we've done so many partnerships. And I'll let questions come in first, but I also want to share some examples of what has taken place with our partnership and our community nurse corps with the nurses from Samuel Merritt, to give you some other ideas of the type of things that they have done and some of the things that they could do. So the first question I see is, do you do screening for hearing and vision for students 0 to 3 years old?
Yes, we do. We definitely do screenings. We have done screenings across the lifespan, actually, because we place our students, regardless of program, in any community-based setting that meets the qualifications for the community service hours to the clients and is available for that day of the week where it fits in the student scheduling. And so they've screened every age. We work a lot with Head Start programs, not here in Sacramento per se, but in other geographic regions like the Bay Area where our campus is located. We do screenings of seniors for fall prevention. We do all types of screenings. And if you have medical personnel on site who supervise, who are there physically to take liability, they can do other types of skin where they're maybe doing an invasive type. Most of the screenings that we do not involve a bodily function screening. I'm using lay terminology here. And in other words, they would be hearing and vision type of screenings or fall prevention screenings, things where we don't need equipment to give shots and things like that.
All right, thank you, Alice. So the next question is, one moment, I'm lost it for 1 second. Can you please provide examples of the types of workshops, education, or screening you provide?
We've done a lot. That's I'm glad you brought that up because we actually cover anything in the health realm, including stress management, mindfulness-based stress reduction, nutrition, how to prepare meals on limited income, sources, community sources for gaining access to nutritious foods. We do a lot of workshops on appropriate development, like at what age should your child be doing this, that, and the other, how to work with finicky eaters, how to expose children to different foods. We've partnered with another community agency and done farm to fork type of things where we have kids grow a bean in a cup and talk about food and where food comes from. Food waste. We also do environmental education, smoking cessation, diabetes management, foot health and safety, first aid. We've done almost every topic you can imagine because we serve diverse age groups and diverse settings in multiple languages, in multiple cultural practices. So Julius can share with you, or I, in how we've worked with the Community Nurse Corps that is exclusive to the Promise Zone, with the Promise Zone partners and what we've done there. We've done bicycle safety, anything that is connected with health and wellness is in our wheelhouse.
Thank you, Alice. So the next question is, do the students select the topics they are focusing on each year, or are there specific tracks that you have so that you always have students focus on diabetes, cancer prevention, and other quality metrics? You kind of
Excellent question. We actually focus on what the community agency needs are. Now, sometimes the community agency says, well, we have a need for this area, or we want you to survey our clients because we're not sure exactly what their needs are. We know diabetes prevention, exercise is important, but we don't know what else. So we often have our actual students do a survey for the organization, but most of the time, I would say the topics are dictated by the organization's needs because you know your client demographics. You typically know your gap areas and they're part of your plan. So you tell us what your needs are, and then our students actually research and put together the educational workshops and programs. Or if they're doing home visits, we've had a partnership with the United Way in the past where our students became almost portable revolving Ask a Nurses. They had kits that they would carry with them that had topics and handouts on just about every topic, because when you're doing a home visit, you don't really know what the needs are going to be until you meet with the family or the care provider or the guardian. So we cover a diversity of topics, and it's really depending on what your needs are. What would you like that you can't currently do or don't have the resources to do, and you'd like to provide to your clients, regardless of age or language, that we can fill that gap. Next question.
Right. Thank you. So Jeff, first want to say Ronnie Cobb wanted to say that it's great information, Dr. Vestergaard. And then the question is, are you finding good success regarding the dietary and ergonomic education you are sharing with students attending class online now?
Well, actually, what we're doing now is placing directly with physical in person. So we're not, the requirement, some of it can be online and some of it is actually at the organization. So I'm coming and appearing for all of you and explaining this so that we can open up possibilities and see what needs you have. I can share with you that it has been successful in what we have done in the online world. We've been working with a high school in the San Juan School District. We have worked with some senior centers and some adult serving who have access to the internet and have done online programming. They have typically focused on nutrition related topics and also exercise. How do you best do that at home? We had one presentation on doing family exercises for multi-age people, so different leveling of exercises. How do you do it? How types of exercises you can do in a small space using home equipment like soup cans, even paper plates. You'd be surprised how fast you can get your heart to beat. Just raising your arms above your head with paper plates. And so and advising and helping and demonstrating and just bringing new ideas. Ergonomics is a little bit harder, but there are some basic things that people need to know about to avoid repetitive motion. And so for adult, that has been a topic of interest for a lot of folks who are now spending more and more time on the computer and developing back problems, neck problems, elbow problems.
All right,
Next question.
thank you. So the next question is from Maria, and it's, we are in the Delta, not located in the city. Are you able to provide us services, or do your services stay within city boundaries?
Our services go throughout Northern California. So we actually provide from down south of Fresno to the Oregon border. We have that capability for online. For in-person, anything in the Sacramento region, we are available. We go Auburn, Citrus Roseville, Wilton, but this presentation is focusing on the Promise Zone and the Promise Zone geographics, but we will work with you to do what your needs are. And yes, we can place there. We can have, if you meet the qualifications and we have a contract and it fits in the student's semester schedule and it's been vetted by our community health staff, we can physically place students there.
All right, thank you.
For volunteers, we can go anywhere because then they're volunteering as independent. In other words, we're not covering their liability. They are volunteering to come online or come physically to your location as individuals.
All right, so I am noticing we are approaching the 10:45 in time that was listed on the information session, but I want to check folks and see, are you all okay with staying a couple minutes longer so questions can be answered and so a little bit of other information can be shared with you all? I see some thumbs up. And also, you know, we don't have you held hostage, so anyone can click off whenever they got ready anyway. But let's continue. So the next question is, can the request for one-time events be year-round?
Year-round, yes. We are year-round, so you can have your requests at any time. We do require advance notice because, you know, it takes me time to, especially if you're requesting a particular ethnic student or a language, because I need to have time to locate that person and make sure that they can be available. But yes, year round and during day, afternoon, evening, whatever time your event is or you have the need, we will try to accommodate an individual request, a one-time request.
Thank you, Alice. So Tom Bennett, a great friend over at United Way, just made a statement that this was a wonderful effort that they offered with the university and Robo School District. And the next question is, will your students be able to assist school districts when the district nurses are giving COVID vaccines? Not giving the vaccines, but helping out during that time period.
Yes, that we love to work with school nurses, as Tani will tell you, because we have done a project in her school, and we want to be of service. So if that's something that's of interest to you, please send me an email and I'll put you in touch with our community health liaisons who actually vet each of those specific requests, and we can get you whatever, either volunteers that volunteer, they are registered nurses, so they can give shots and they volunteer to come and do that, or we can place as part of community health.
All right.
Tommy's excited.
So the next question is from Belinda. I have a learning hub on my campus that has approximately 25 to 35 students. I would like a nurse to visit once or twice a week to assist us with students on campus, taking temperatures, advising us on when students need to go home or can stay on campus. Let me scroll. I'm sorry. To stay on campus. I lost my place now. Based on the symptoms they are exhibiting.
Okay, so I'm not sure how long they would be there. If you want them a couple hours or whatever your needs are, please get in touch with me. And we can discuss it and see if we can line up one of the already licensed nurses who could come and do that kind of screening on a regular basis, because we do have our alumni network of graduates who want to come and volunteer based on their availability. So we will work with you on that.
All right, I think that ends our questions. We have some folks thanking us for the presentation. Thank you all for listening to the presentation. So let me give you a little bit more information so we can let you go. I know we already held you late, but we've had a really great community nurse corps partnership with Samuel Merritt University, created through our engagement with Dr. Alice Vestergaard. And they were able to partner with entities like Urban Strategies and also La Familia Maple Neighborhood Center. They're able to do wonderful things like help create walking groups, help create programs that focus on things like stopping smoking cessation, focusing on all of heart health related things. They did things that help create community ambassadors where they train folks to go out into their homes, into the community, to educate others on things like nutrition and exercise and et cetera. Also at La Familia, they were able to help create a wellness room where it was a great space where people can go and be mindful. I think it was actually called a mindfulness room, and be mindful, do things like meditation, yoga, breathing techniques, etc. So I'll stop there, but you can see they do some really wonderful stuff. And I think what Alice is trying to get folks to understand is that the possibilities are pretty wide. I won't say limitless, but pretty wide. And so whatever you can think of that might be most beneficial to the people you serve, it would be great to reach out to Alice to see if that's possible, to identify nurses who can do whatever you can think of. So with that being said, I want to thank you all. So many of you are already Promise Zone partners, but I want to remind everyone to please reach out to me. I'll put my email address in the chat. But please reach out to me to connect to partners, to share information about the great work that you all are doing, to share information about the opportunities that you have either for other partners or for the community. and we would share that out across our networks. We have over 400 plus community leaders across all sectors. So our elected officials, our nonprofit leaders, our school district leaders, you name it. And we would share on our social media, on our e-blast that we send out, and also our monthly newsletter. Also reach out if you want to help get connection to funding. The Promise Zone initiative is focused dominantly on federal funding, but we also do some great work to identify non-federal funding as well. And with that being said, I want to give a shout out to our HUD community liaison, Dr. Michael Huff, who's on the call. His role with us is to kind of help engage with the federal agencies. We have really deep, real relationships with federal agencies. And he also does an array of other great things for us. So always want to thank him and give a shout out to him. And then also I put a little message in the chat box to ask you to please follow us on Facebook. And the reason why I say do that is because as I just asked you all to share the opportunities and resources that you have, our staff share out all that information. And so it's our Promise Zone Facebook page is like a one-stop shop for you to be aware of all of the resources and opportunities that's out there in the community. It'd be great for you to follow, but I think it's even more important that you encourage the people that you serve to follow. You know, many of you are doing great work in the areas that you're focused on, but we know people need resources and opportunities across all spectrums. And so if you're providing the education, you know, there's partners out there who can provide the health or help with housing or help with getting free COVID testing or help people know where they can go and get free or low cost food or all kinds of things. So the Promise Zone page is a place for that. And with that being said, I want to thank you all. Let me get one moment to just throw in my email address.
Nice to meet you in the electronic world, and I look forward to getting your emails and let's talk, because we're here for you. We have students, you have needs, and let's partner to enhance the health of our community.
All right, great. So have a wonderful, wonderful day and enjoy the rest of your weeks. And maybe now we can all collectively breathe a sigh of relief and try to focus on getting things back to our new normal.
Yes. Happy New Year. Good to see you, Alice.
Good to see you. Happy New Year, everybody. Bye-bye.